class. Today we are going to be talking about the rabies virus. And it is a super interesting virus because it is still fatal to both animals and humans. And really, if you're not aware of the signs and symptoms and you don't get taken care of, there's a good chance you'll die. So it's a very important virus to know about, and we hope that we can help you understand it a little better in this video. The rabies virus is a member of the Rhabdoviridae family, and the viruses within this family have a very distinct bullet shape, so they're very easy to recognize. If you were to look at one and to see that it was a bullet shape, then most likely it is a member of this family. It also is in the Lissovirus genus, and it shares this genus with the Australian and European bat viruses, which sound pretty nasty to me. Its genome is RNA, and one of the main differences between genome, DNA, and RNA is that RNA genomes will attach to the host cell and then fuse with endosome membrane and release its nucleocapsids into the cytoplasm of the host cell, while the DNA viruses pass their DNA directly into the nucleus of the host cell. So that is one major difference between the two. This next image is an example of a rabies virus. We can use it to help us better understand its morphology, or in simpler terms, its size and shape. As you can see, the rabies virus is an enveloped virus, meaning that the nucleocapsid is surrounded by a lipid bilayer, which comes from the modified host cell membrane, and is surrounded with an outer layer of glycoproteins that appears little spikes with hooks on the end, and we know that these are used to attach the virus to other cells. As you can see from this picture, the rabies virus is a single-stranded RNA with a negative sense, meaning that the negative virus is not infectious by itself, as it needs to be transcribed into a positive sense RNA through replicase enzymes. As you can also see from this picture, the rabies virus has a helical ribonucleoprotein core and has a non-segmented strand. You can also see that it contains 5 separate proteins within, an M, N, G, L, and P protein. You can also very easily see that classic bullet shape that I've talked about before that is very typical of this virus and makes it very distinguishable from others. Okay, now we can move on to my absolute favorite part of this disease, which is its reservoirs and its signs and symptoms. Before, when I pictured rabies virus, I'd always think of some wild dog frothing at the mouth with saliva and just going crazy. But really, any mammal can be a carrier for this disease. So that even includes humans, which is pretty sweet and kind of scary. But for that reason, it's been given the name of the zombie virus by some, because it is probably the most likely virus or disease out there that would actually cause a zombie apocalypse. And I don't know if that could actually happen. I seriously doubt it, but it's still pretty cool to think about, and it gets those Walking Dead fans pretty excited, so it gives them a little hope that they might be able to prove it. So while any mammal can carry the disease, some of the most common ones in the wild are raccoons and foxes, no surprise there, coyotes, skunks. Don't let that cute face fool you. They do sometimes get rabies. Watch out. And last but not least, vampire bats, or just bats in general. Fun fact is my aunt was serving her mission in South America and was bitten on 3 separate occasions by vampire bats. And she had to go get rabies vaccinations for the bites. And while the rabies virus is more common among wild animals, it is important to remember that it can be passed on to domesticated animals as well, whether it be livestock, horses, cats, or dogs. Remember that any mammal can carry this virus. Moving on to the signs and symptoms of the rabies virus, it is important to remember that signs are the things that the doctor can see is wrong with the patient, and the symptoms are what the patient is actually experiencing and suffering. So it's important to know that when you are infected with the rabies virus, it will travel through your peripheral nervous system until it reaches your brain, and once it reaches your brain, these symptoms will start to show. They start out as very slight symptoms, such as a flu. One day you might wake up with a headache, a sore throat, maybe even a little cough. But as time goes on, it progressively worsens, and the patient will slowly become anxious and confused and will lose track of time. And this leads to hyperactivity, They will have a hard time standing still. They will be fidgety and start making weird movements with their head and other parts of their body. This leads to hypersalivation, which is that classic frothy foam that we see from rabies victims, whether it be animals or humans. It's because they are producing more saliva, and in turn they also are having painful throat spasms that keeps them from swallowing their own saliva. So that doesn't help. This also leads to hydrophobia, which means the fear of water. Rabies virus patients will start to fear liquids, partly because they cannot swallow it anymore due to those painful throat and larynx spasms. And also they will not be able to eat food because of those spasms. And finally, it will lead to encephalitis, which is the swelling of the brain. Once it reaches this point, it's pretty much game over for the patient. They will start to experience delusions, hallucinations. They'll become extremely confused and fall in and out of consciousness until they finally fall into a coma, and that will lead to eventual death. One of the scariest things about the rabies virus is by the time the clinical signs of the virus occur, the disease is nearly always fatal. So really any doubt merits a checkup. Another crazy fact is the time between contracting the virus and the symptoms showing is usually around 3 months, but can occur in as little as 1 week or take years. So you can be bitten and 8 months later you could start showing the symptoms and it's too late. You will most likely die.
The rabies virus is generally transmitted through the bite of a mammal. It is transmitted through the saliva that the animal passes one to another. It is generally passed from dogs to humans, but dogs, bats, cats, foxes, and raccoons also can all pass and be infected by the virus. Any mammal is capable of being infected by the rabies virus. A human can even pass it one to another. There are documented cases of an infected donor transplant giving the rabies virus to a recipient of the organs. While it is technically possible a human could bite another human and give them the rabies virus, there has been no documented evidence of this ever happening. The United States is in a low-risk area because of the prevention that they have done. They have given inoculations and vaccinations to dogs and other domestic animals to limit the amount of animals who are able to contract and pass on the rabies virus. The prevention of the rabies virus began in the 1960s in the United States. The main carriers of the virus, dogs, were given the rabies vaccine to give them the resistances to the virus so that they wouldn't contract it and pass it on to the humans. While it is currently law in many states that dogs are required to receive their rabies vaccination, cats and other domestic animals are not required. And this has inhibited the prevention of the rabies virus in the United States. Many other animals, such as bats, coyotes, and foxes, are unable to receive the vaccinations because they are not domesticated animals. The rabies virus is treated even if there are no symptoms on the very day that the person is bit, so that the antibodies can be made in case the victim does indeed contract the virus. They are generally given the rabies immunoglobulin, which are antibodies that have been made in a laboratory so that before symptoms arise, the person can have antibodies in their body to overcome the rabies virus. They can also be given a vaccine. If they are previously unvaccinated, they will be given 4 to 5 inoculations beginning on day 0, then on day 3, 7, 14, and 28 if it is a severe bite. The people who are already vaccinated do not need to receive this many inoculations because they already have antibodies in their system. They receive 2 intramuscular doses of the vaccine, first on the day they are bit, and the second is on the 3rd day after. The rabies virus is generally treated with palliative care for those who have already shown symptoms. If they are showing symptoms, that means they are infected with the virus, and it is improbable that they will survive at that point. Palliative care is more for the victim than anything else. It's sedation, pain control, comfort, and physical restriction to not pass on the virus. There is a Milwaukee protocol where there is a chance that the person will live as long as they were previously vaccinated at some point or they are healthy. Given a course of aggressive drugs, these drugs include amantadine, ketamine, benzodiazepines, and barbiturates. These will help the person slow the progress of the rabies virus so that their body can have time to create the antibodies necessary to overcome the virus. The most popular vaccine used in the US is called Lexicomp. It's useful pre- and post-exposure to the rabies virus, meaning that you can receive a shot of vaccine before and after your exposure to the virus, and it will help you develop the antibodies necessary to overcome the disease. It is administered intramuscularly, meaning it is given as a shot, and it is an inactivated vaccine. The virus was grown and killed in a laboratory so that it can be injected into you, giving your body the opportunity to create antibodies to overcome the virus. 97% of healthy individuals maintain immunity for 10 years after their first inoculation. People are suggested to get inoculations every 5 years. It's often given to dogs to help them develop an immunity to the rabies virus. Left untreated, the mortality rate for rabies is considered to be 100% lethal. There are a few documented cases of people recovering from rabies, specifically from the Milwaukee protocol, but generally they die. There are 55,000 deaths a year from rabies worldwide. The US only has 200 of them because of all of the work in the prevention of rabies that they've done. Most people who die from rabies are from third world countries. In Japan, we can see the figure 1 that shows and indicates that the mortality rate of rabies cases is nearly 100% death.